Namaste and welcome. I'm Minakshi. I'm going to guide you for this class for your first trimester. The aim of the class is to work on the symptoms like headache, vomiting, constipation, mood swings, lack of energy, fatigue, feeling low. I'm going to try to give you poses which are safe and which is going to give you a lot of strength and flexibility. But still, if you find it's hard or if you feel some discomfort in between, please stop and you can consult your doctor before starting any kind of physical workout. So let's just get started. We're going to start with the neck rolls first. So inhale and exhale always through the nose. From here, let's create circles, just 5 times clockwise and 5 times anti-clockwise. You allow your neck to fall in all the directions. But if you have any kind of cervical spondylitis or any neck pain, please do not practice these neck rolls. Now other direction, change. Again, just focus on the breathing. So breathing is the medium to connect your mind. Keep breathing and release now. We're going to do child pose. You can say Shashankasana. For Shashankasana, you can use a pillow or a bolster. So keep the toes together, knee wide open, and take a deep breath. Inhale. You're going to take the arms forward, resting on the bolster, and then from here, if you want, you can bring the forehead also down, just resting the head down and stay there. Just keep breathing. And inhale, just release now. Now you can remove the bolster from here and come to the palm, come to the knee, come to your all fours. We're going to do Marjorie Asana, which is called cat and cow. So you're going to roll the shoulders back, okay, roll the shoulders back and chest out. Look up. Exhale, hinging the back, lifting the back higher. Inhale, you are working on your spine. Exhale. Your spine will help you to improve the blood flow in throughout your body. And breathe out. Inhale, deep breath. Breathe out. Breathe in and release now. From here, we're going to enter into Adho Mukha Svanasana. So for that, tuck your toes in and you're going to lift your knee up. But I want to say this pose is not for them who has vertigo problem before. Okay, so lift your knee higher, lifting the tailbone up. Keep breathing from here. And release now. From here, drop your knee down. So you can come to the kneeling position and release. Now we're going to work on the Gomukhasana, but this is a variation of Gomukhasana. I'm not sitting in the proper leg position, I'm just sitting in the kneeling position. And then from here, taking your left hand back, try to take it in the center line, as much up you can take it. And then from here, right hand up, grabbing your fingers together if it's possible. If it's not possible for you, just simply take your right hand up and hold with the four fingers, try to stretch it back. So this is the variation what you can choose, whatever you feel okay. And I have another variation. If you want to practice, you can grab a belt, just hang belt or any cloth you can take, and then just join, um, hold from behind. So inhale, nice and deep breathing, look up. So lungs are open, your chest is open, deeper inhale and exhale. Breathe out through the nose. Inhale and exhale. Inhale, exhale, breathe out. Release. Now we're going to do it from other side. So take your right hand back and then left hand up. You grab your fingers and hold. And sometimes one side is harder than the other one. It depends if you are right handy or left handy. So if you are right handy, so whatever hand is down, you will feel in that arm. Okay, so hold, keep breathing, inhale, through the nose. So it's always helpful if you keep your chest out and slightly keep your chin up. It's helpful to inhale more oxygen in your chest, and it's going to improve the oxygenation of your blood, and a lot of oxygen you will receive and will send to your baby. So just choose your variation accordingly. That is the most important thing. Okay, release now, and now you can sit back. And the next pose what we can do is Baddha Konasana or butterfly, or you can say Titli Asana. So then join your feet together and then hold. Now lift your knee up and try to push your knee down. Inhale up, exhale down. Or you can do little swings also, but I would suggest you to not do fast swings because the first trimester is slightly risky and you will feel some kind of moving, like liquid moving in your abdominal area. So that is not suggested and recommended. So try to be slow and listen your body. And make sure you're not doing any kind of over stretching. Just stay gentle and focus on the breathing part. Okay, release now. We're going to add some side bends here. So now you're going to take your left hand to the left side, sliding it away, and make sure you are not taking the shoulder close to your ear. Okay, so take your hand away, and with inhale, take your right hand up and try to bend whatever is your possibility. And then release from here, change to other side, take your right hand far away and then left hand stretch over your head. Keep breathing. And then release from here. Now you can come to the knee again and then try to slide your right knee front. Okay, we're going to enter into Raj Kapotasana and then take the foot out. And I'm not asking you to do it like deeply, just do it as per your comfort. And then take your left leg back as much you can, and make sure you're not sitting on your right hip. So the knee which is bending, try not to sit on that hip. Try to shift your body weight on the leg which is straight behind. Okay, just try to stay there, and you can drop your elbow down, or you can always use blocks under blocks, or you can use a bolster in front of you. Okay, just as per your choice, just hold and then release from here. Now take your right leg back, and now slide your left knee front same way, and taking the foot out, taking the right thigh back as much you can, whatever is the possibility, and do not sit on the front hip, and stay on the palms and up. Keep breathing. This pose is very important to practice. I'm adding this, maybe you find it hard, but I'm adding it because in your upcoming months you will start feeling some kind of sciatica pain or lower back pain. Reason, because your uterus is growing, and that is going to keep some pressure on the lumbar region, and the sciatica nerve is going from there, it's running from here to here, and then in that case you will start feeling some kind of problem in your walking or long time sitting, or your daily activities. So this pose is your uh, choice to add. If you find it hard, then you can totally skip it. Okay, so now we're going to work on the Anjaneya asana. Now step your left foot front, and not in the middle of the palms, just bring it the outside of the palm. Okay, so left foot front, and now inhale, you're going to push your front knee front, and back glute you try to squeeze. With breathe out, squeeze. If you find it hard for your knee joint, you can place a blanket or a towel under your knee and push your knee front. If you are okay with this variation, you can raise your arms up and breathe out, release from here, taking your leg back, and then we're going to do it from other side. So step your right foot front, and then inhale, bring the palm interlaced fingers on the knee and push your front knee front. So here you're working on your ankle mobility, knee mobility, inner thigh. You're working on your uh, glute, and you are working on your lower back. So inhale, and with exhale you push your knee front, and then taking the arms up if you find it perfect for you. Keep breathing, and then breathe out, release, and take your leg back. Try to stay on the kneeling position again, and then interlace your fingers, take the chest out, and look. and then release. Now, from the kneeling position, we're going to work on Malasana, so which is deep squat position. So for Malasana, you come to the feet and taking the knee out, okay, and then with your elbow you push your knee out and then release from here. Now from simple cross leg position, I'm going to drop your left elbow to the left side and then catch your right big toe, lift your right leg up. Try to stretch the hamstring, your calf, taking your foot in. Keep breathing. 3 breaths. So one breath is one inhale and one exhale. And then release from here. Now just slowly come up and then change to other side. So sit with a simple cross leg position and then drop your right hand down and then taking your left leg up in the same way. Keep breathing. Exhale, release from here. And now we're going to start some breathing. Now just simply inhale from the nose, exhale from the nose. Inhale in the 4 count. So I'm counting for you. 1, 2, 3, 4. Make sure you are not holding your breath. Breathe out. 1, 2, 3, 4. Again, inhale. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Inhale. 1, 2, 3, 4. Breathe out. 1, 2. Go slow. 3 and 4. Release. And now we're going to do Shavasana. For Shavasana, you can use a pillow. So once you become pregnant, try not to lie down on the belly and try not to lie down on the back as well. So make sure you lie down on your left side, which is a recommended and good position. So keep the pillow in between your knee. So it should not be too thin or too thick. Then drop your elbow down and stay in Shavasana.